calling it a disease, see? And to give it that name, AIDS. So everything's included under that, and you don't have to just say, I mean, if you'd have said, you know, these people are getting a lot of weird diseases, all kinds of diseases, it wouldn't have had the same impact. It was much better to say, there is an infectious organism on the loose in America, and it could get you.
I had interviewed the world's leading HIV experts and discovered that the two benchmark diseases of AIDS have alternate explanations. Once again, I turned to Dr. Gelderblum, seeking proof of HIV's existence in the most recent images available.
Here, you do not see anything about the details, but I would say it's probably a virus.
These are HIV here?
Yeah.
Oh, so are these HIV too?
Yeah, yeah.
Everything's
Probably.
Probably.
Yeah.
What can I tell you? You know, I mean, it exists.
Gallo said he had all these viruses, and it was a lie.
I think HIV totally has turned out not to be the cause of AIDS. HIV has turned out not to be.
Gelderblum's images, said to come from isolated HIV cultures, provided no proof for HIV's existence. So I asked Nobel laureate Dr. David Baltimore and Dr. Robin Weiss how they would isolate and photograph this elusive virus.
Well, didn't Dr. Gallo do that? I mean, he actually isolated it, so... Yeah. I mean, why should I do all of this? This is all textbook stuff you're asking me.
I'm not quite sure what's behind your question about isolation.
I don't want to be your textbook, you know? Okay. I got other things to do.
They're embarrassed. The scientists have been embarrassed about this. They know that it's flawed.
In 1987, the CDC made two mind-boggling changes in the definition of AIDS, which are in effect today. You can be diagnosed with AIDS without ever having an HIV test.
In 1987, I had a lesion on my arm, and it was KS, Kaposi sarcoma.
A doctor diagnosed you with AIDS without an HIV test?
Yeah.
You can be diagnosed with AIDS if you've tested negative for HIV.
Alvin Friedman Keene found 16 patients with Kaposi sarcoma among gay men in New York City in the 80s. They did not have HIV infection. Yet they had AIDS by our definition, right?
In a World Health Organization publication, Dr. Chin writes, "It should be emphasized that the surveillance definitions for AIDS were not intended to be reliable indicators of HIV infection."
If you have thousands of documented cases of AIDS without HIV, how can HIV cause AIDS?
Why do you believe that HIV does cause AIDS?
Because that's all the information that I've been given.
Because we've never been taught anything different. We have read it, heard it.
Because that's what the scientific community has told us.
Scientists are supposed to observe, experiment, and reason from what they observe. They're not supposed to grab hold of an idea and cling to it and adjust everything else in their perceptions to fit that idea.
Any drug active on HIV will be toxic because it's not 100% specific on the HIV enzymes.
The treatment causes a very similar condition we would expect from an AIDS patient. That's why nobody noticed that there was something wrong with the treatment.
I remember in 1992, after I first tested positive, I became involved in an organization called Women at Risk. There were 11 of us at the time on the board and involved in the group. All of us except 3 were on the medications. In the year and a half that I was involved with Women at Risk, every single woman in that organization on the drugs died. Every single one, except the 3 of us who weren't taking them.
We weren't just given handfuls of AZT, we demanded it.
AZT, where is your humanity?
We considered the FDA not giving us these things as being anti-gay instead of being responsible. And so we went and we lobbied and we pushed for all these things, and we didn't think clearly about what it was we were asking for. It's like that saying, be careful what you ask for, it may come to pass.
That's the very reason why everybody believed HIV is a deadly virus, because the HIV-positive patients at that time got a deadly treatment.
Despite the billions spent on the drug, tens of thousands of people with AIDS have died. And now a growing number of studies are questioning the drug's usefulness.
We just decided between ourselves in November to write to Peter Duisberg and say, sorry to bother you. Are you for real? And if Lindsay were your daughter, what would you do? On November 11th, we got a big package, and he said, you must take your daughter off AZT immediately or she will die from it like Kimberly Begalis.
That is AIDS by prescription. You get immunodeficiency and you die from the tox. That is AIDS by prescription.
When AZT became widely available in 1985 and 1986, I cautioned my patients not to jump on the bandwagon and start being treated. I didn't want to see my community poisoned by an ineffective therapy.
I think in retrospect, the dose that we started with AZT was a dangerous and poorly tolerated dose.
Nobody wants to realize what was the real effect of this overtreatment. That means that we killed a whole generation of AIDS patients.
The evidence shows that this disease is not merely confined to the gay community. I motion to call the disease Acquired Immune Deficiency Syndrome, AIDS.
In 1982, Dr. Harry Haberkas was one of the Centers for Disease Control's epidemiologists tasked with defining AIDS.
AIDS refers to a syndrome, and its definition changes periodically.
AIDS is a chronic disease. It's based on its immunodeficiency.
AIDS is not a disease, right? AIDS is a whole lot of different things. Depends on what country you're in.
When your CD4 count falls below a certain arbitrary level, by definition, you have AIDS.
You know, when someone's count goes down and then it goes back up again, it's, you know, politically they may still have AIDS. Medically, I don't think they do.
If you develop any of a number of opportunistic infections or diseases, that puts you in the category of AIDS.
We don't even know what AIDS is. AIDS is so hard to define because they change the definition of it every year.
The definition of AIDS has broadened over time. It was revised in 1985, and then again in 1987.
The changes in the definition have been political. Every time they change the definition, the numbers go up.
The definition has changed many times. The biggest change was probably in 1993, which they then, added the CD4 count and HIV, and, so you could not even be ill, but if you had a CD4 count consistently below 200, you now had AIDS.
A closer look at the Centers for Disease Control's documents reveals that AIDS numbers actually declined in 1993, but a retroactive definition change increased the estimates by more than 100%.
The more diseases they could lump into this AIDS syndrome, S stands for syndrome, the better the chances are they get patients under that umbrella, the more patients they could catch.
As time goes along, definitions get used for a variety of issues, and some of those are not based solely on scientific decisions, but politics and capitalism and reimbursement comes into play.
For example, a person with hepatitis C, even say here in San Francisco, if you've got hepatitis C and only hepatitis C, you're shit out of luck.
Having an AIDS diagnosis, I get a free apartment. The city of San Diego pays my apartment.
I can have the state of California pay for many medications related to HIV.
I get Social Security benefits.
I can get discounts on my supplements at the local health food store.
I also get food stamps and in-home supportive cleaning services.
So I was basically a healthy person walking around, and yeah, I had all these wonderful little perks,
You get all these benefits, I mean, that we fought for and got, but the end result has been a sort of an imbalance. I mean, we succeeded, I'm glad we did, but it is a little unfair.
Politics, insurance, capitalism, benefits, you can be sick or healthy. I never would have thought that AIDS was so convoluted.
Right. Well, as I said, that has changed. How you define that scientifically has changed quite often, which just makes it difficult to, for the lay people to understand. It makes it difficult for me to interpret the numbers.
The first AIDS meeting on the continent of Africa was in 1985 in Bangui.
We were there with a few people who had experience on AIDS in Africa. And one of our problems was, how can you diagnose AIDS in Africa in the absence of very sophisticated laboratory support?
Even though by 1985 there was a HIV test, most of Africa didn't have access to it. So one of the things that we did in that meeting was to sit down and hash out the so-called Bangui criteria for the diagnosis of AIDS in Africa. The idea was, what would be a simple way for a clinician to look at a patient and say that this patient likely has AIDS?
We say somebody who has a combination of certain signs and symptoms like major weight loss. And if you have a combination of that, you can say this is probably somebody with AIDS.
They wanted a clinical case definition where they could decide that someone had AIDS just by looking at weight loss and persistent fever and so on.
It gave something to clinicians in Africa to diagnose AIDS.
And that helped in the overall effort to count cases, because we needed to know what was the impact of the epidemic.
They could discover AIDS all over Africa at that point. They could say that we are all at risk, but they could say it's spreading around the world. They could say it affects women as much as men, because almost anyone in an African hospital could be diagnosed with AIDS without having to do the HIV test at all.
Whole nations have been led to believe that, in some instances, that they've got large percentages of their population infected and doomed because of this supposed sexually transmitted virus. It's such a tragedy.
And here come a white man with doctors who you respect, and they tell you that there is now among you an invisible disease, and it gets into your blood and can stay there unseen for years, and when it manifests itself, it's going to manifest itself in the forms of diseases you've always known.
Maybe if you look skinny, if you lost weight, maybe they'll simply say, hey, you have AIDS, or you're coughing a lot, maybe. They'll say you have the disease.
This cannot help but create extraordinary paranoia in people's minds. They say, well, what is going on with us? My neighbor next door he's got malaria. Does that mean that he's actually got this dreadful disease that the whites are talking about?
Like I could be fat now, then the mentality is that if ever I become teen, then it could be one of the symptoms. I have to ask myself, why now? Why at this time?
Dr. Christian Fiala argues that many doctors have misused the Bangui definition.
In the era before AIDS, we had to admit we don't know the diagnosis and we could hypothesize. But nowadays, what doctors do is, well, if we don't know what it is, it must be AIDS.
We did have patients with the conditions we now regard as AIDS defining, even before the advent of AIDS.
People could have TB and not have HIV and fulfill the Bangui criteria. They'd lose weight, they'd have TB, and they could look like they have AIDS when they don't.
Is this Bangui definition still being used today?
I'm fairly certain that in many parts of Africa where there's still little or no testing available, that definition is still used, and I wouldn't be surprised that it's used in the poorer parts of Asia.
This word AIDS, I don't know what it is anymore. I don't know what we're talking about anymore when we talk about AIDS. AIDS is one thing in Greenwich Village and a very different thing in Kampala, Uganda.
I visited the World Health Organization's website searching for answers and discovered there are currently more than 12 different definitions of AIDS worldwide. So I turned to Dr. James Chin, former head of the WHO's Global HIV Statistics Unit, for an explanation.
Some countries, they felt they were a little more sophisticated than in others. And you have, you know, along with the epidemic of HIV, epidemics of HIV/AIDS experts. And some of them will not necessarily adhere to any international definition. They'll make up their own definition.
High school. In June of 2007, the BBC featured a news story which began, HIV Infection Theory Challenged.
Living cells are complicated, and how they work inside the body is even more complicated. So there's still a lot of debate as to how exactly HIV causes AIDS.
In March of 2008, the Washington Post went on to state that multiple surprises have reminded researchers how much they still don't know about HIV's biology.
HIV has got to get inside the circulation of the body, and it does that in ways that are not completely understood.
The prime target for HIV is a T cell population called CD4 helper T cells.
The way that the virus gets into the target cell, it fuses its membrane to the membrane of the cell.
I don't understand the fusion process. I don't think anybody completely understands it.
We have a relatively poor understanding of how viral proteins interact with proteins in the cell.
How come our antibodies aren't able to keep HIV in check?
It's an excellent question. That's one of the great stumbling blocks.
They can't prove that HIV is the cause of AIDS, okay? They cannot prove that HIV is the cause of the collapse of the immune system, no matter how many scientific journals says it is. When you go to the basic research, it doesn't prove it.
We are almost convinced that there is other factors that are involved in the loss of CD4 cells, and we don't know yet all the mechanism.
How HIV depletes the T cells so an individual advances to AIDS is probably due to multifactorial elements. One is it will kill the cell eventually that it infects. HIV does not necessarily kill the cells it infects. Some T cells are directly killed by HIV, and other T cells keep the virus in check. It's a silent state within the cell, and I think in many cases these cells can return to a normal function.
Can that cell return to a normal state? I don't think so.
When I was told I was HIV positive, I accepted that on a very deep level. But only by having the courage, the open minds, and the open hearts to answer these questions are we ever going to know how to help people, how to do what we need to do to help people.
In late 2007, Science Daily reported that 3 prominent research teams had published papers in the Journal of Immunology challenging the theory that the sudden loss of T cells triggers disease and AIDS.
The details of HIV pathogenesis, how HIV kills people, are still being worked out.
If the sudden loss of T cells in HIV-positive individuals can't explain why people get disease, then there must be cofactors that cause people to get sick and die, or factors that have absolutely nothing to do with HIV. While researching HIV hotspots, I began to realize there is a direct correlation in these places with another condition that leads to immune deficiency and death.
I think it is important to keep in mind, especially for us in the West, that poverty is not a romantic issue. It is a deadly issue. Poverty leads to diseases and premature death, period.
When you look at the symptoms that they talk about, for people that are HIV positive, you find that some of them, they are more related to malnutrition.
Their nutrition is not very equilibrated. They are in oxidative stress, even they are not infected with HIV.
So their immune system doesn't work well already.
People are hungry, they're underdeveloped, there are no hospitals, there's no proper medical care. You take away poverty, you're giving people an ability to fight infections.
These are toilets?
Yeah.
We don't have flushing toilets. When flies get into the toilets, they actually come back to touch our food, you see. And look, we need to take that food. And we don't know which infections are there.
So how do you expect people must survive in these places? Look there. How many white people they are staying in this house like this one? In Cape Town it's different. You go to suburbs, you see the suburbs is different from our places.
Why have we done nothing for African people, just like give them clean water so they don't die in infancy of diarrheal disease and stuff like this? All we care about is HIV, AIDS. Well, question. Well, there's money in it. There has to be, other dynamic working to lead public interest to the African situation and ignore clean water, sanitation, malaria. I mean, things that kill people.
This is the beginning of a war. It is a war to reclaim our health.
In 2008, USA Today published a news story that stated, if we look at the data objectively, we are spending too much on AIDS. About $10 billion a year is spent on AIDS, while 2 billion people live with no sanitation. 1 billion lack access to clean water. And malnutrition kills someone every 10 seconds. These factors enable diseases to thrive and severely weaken the immune system of those living in such squalor.
If we were to take all that money and put it towards developing poor countries, God would be so proud of us, indeed, because we would have taken away the major challenge that's facing humankind, and that is people dying in silence. It's slow, painful deaths from being scared of something that was just packaged as AIDS.